Hi, my name is Dr. Manish Rao. I'm a consultant child and adolescent psychiatrist, and I'm here today to talk to you about some of the myths and misconceptions about autism. So let's get into it. There are loads of myths and misconceptions about autism, and that can be really damaging but also really insulting for people who are autistic. And I think it can act as a barrier for people to obtain assessments to understand whether or not they're on the autistic spectrum too. So let's explore some of them today. So one of the myths and misconceptions is autism an illness or a disease, or does it need to be cured? No, absolutely not. It's not something that needs to be cured or can be cured. It's a different way in which people might experience the world, and that could be in relation to sensory things or how they might interact with people. What's really important actually is recognising the strengths that people who are on the autistic spectrum might have, but also some of the areas in which they might need some additional support. Another myth is that all people who have autism have intellectual disabilities. I find this a really bizarre concept. Absolutely not. In the same way as everyone else in the general public, people have a wide variety of strengths and needs, including ways in which they learn in a good way and things that they might find more difficult. And exactly the same applies for people on the autistic spectrum. You may have heard that autistic people do not want to socialise. Again, this is really untrue. There are plenty of autistic people who really love social interactions, but some of the areas sometimes they might find a bit of a challenge. But absolutely, much like everyone else, they really value connections with people and wanting to have friendships and relationships in the future. It's important though, just identifying if that's an area that they might need some additional support with. Some people have commented that autism is caused by the way people were brought up, whether that's by how their parents might have managed them in the past. This is really untrue, and all of this has been debunked for a really long time now. We know that parents of autistic young people are exactly the same as any other parents, including those with neurotypical young people. They're trying their best in the same way all of us are, and trying to manage some difficult situations, but also really advocating for their children in the same way. Some people wonder whether autism can only be diagnosed in childhood. Actually, this isn't true. I think it's fair to say that we have a much broader understanding of autism now than we did many years ago. It's true that a lot of the time these kind of difficulties are picked up more commonly when people are children. However, sometimes some of these signs and symptoms are really subtle, and so they only present themselves a bit later on in life when either someone understands themselves a little bit more and wants to explore in a bit more detail. And absolutely those assessments can be done in adulthood as well. Is autism caused by vaccines? And honestly, I can't believe we're still having this conversation. This is something that has been debunked for a very long time, and often it was based on fraudulent research actually from 1998, and the person who actually originally did that research is no longer practicing. So really important to make this very clear that there is no evidence to show that autism is caused by vaccines. And the reason I say that is because vaccines are also a really important part of healthcare for young people and adults as well, to make sure that everyone is safe from common conditions that previously have caused us lots of problems. I hope you found this video helpful. I'm really aware we've only touched upon a few myths and misconceptions about autism, and there are lots more out there, and I think it's really important that we continue to challenge them and continue to show that they're just not true. As previously mentioned, these myths can often be really obstructive and problematic for people to obtain assessments that can be really important and helpful for them, but also can be really insulting for people who have a diagnosis of being on the autistic spectrum, and doesn't go any way forwards for us making sure we live in an inclusive place where everyone feels welcomed and everyone gets the support that they need. Thanks so much for watching, and I look forward to seeing you in the next video.